Hello everybody, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India. I also do hip arthroscopies. So welcome to this video in which we're going to talk about hip arthroscopic surgery. What is hip arthroscopy? So the hip joint is a joint. It's a ball and socket joint. The ball is big and the socket is also quite big. So it sits on the ball nicely, occupies almost 60% of the ball surface. So it's a stable joint as compared to the shoulder. So how does it cover the ball almost completely? It covers it because at the end of the socket, there's a washer called the labrum, which kind of sits onto the ball and nicely cups it to make it more or less like a vacuum inside. Now, sometimes the socket can be excessively sharp or the ball can be a little bumpy near its neck, because of which the labrum or the washer gets rubbed, causing something called a labral tear. So when the socket is excessively sharp, we call it a pincer mechanism. And when the ball's neck is a little bumpy, we call it a cam mechanism. And because of which you get a labral tear and you have pain in the hip. This whole condition together is called femoroacetabular impingement. Classically, the patient presents with a difficulty in sitting cross-legged or rotating the hip, etc. Pain in the hip, especially with sporting activities. It may be mistaken for some kind of muscular pain, but important to get identified to be sure it's not femoroacetabular impingement. Now, how do you take care of this? This can be done through keyhole surgery. What do? You take off the excessively sharp socket and repair back the washer or the labrum to it so that you have a nice tight vacuum and it holds on to the ball nicely. Or the little bump on the neck is flattened out with a shaver or a burr to basically make sure there's no rubbing between the labrum or the washer and the neck. This is done through a couple of holes just in the hip. It's a daycare operation. You're out the next day, the same day. You can walk with a walker, putting a little weight. However, you can go down to a bike only after about 2 weeks to do cycling, etc. Stationary bike, walker for about a week, 10 days. And in about 6 to 8 weeks, you can get back to most activities that you want to. Apart from that, in the hip, little pieces of bone may circulate called loose bodies, or small tumors called chondromatosis may form. These are bony tumors, cartilaginous tumors that may get stuck within the hip joint, causing mechanical problems. These can be removed through keyhole surgery, and it's very successful. Daycare operation, you're out and up immediately after the operation. Also certain infections in the hip. So when infections get in, it's important to figure out what the infection is. You need a biopsy, you need a culture. So through hip arthroscopy, we can take out a part of this tissue, send it for culture, clean up the joint, which in the past required open surgery. So these are a few indications of hip arthroscopy. It's a very successful operation in my hand, and a lot of people can gain from it. And many times you consider in a hip, if there's a problem, the only solution is a hip replacement. No, there are many conditions that can be solved through keyhole surgery. So if you're having hip pain, difficulty in moving your hip, do come and see me, and it may be the solution to your problem. I hope you've understood a little bit about hip arthroscopy, the conditions in which we do it. If you like my channel, please like and subscribe to it. Those who like Hindi content, we have a Silver Play successful Hindi channel. Please like and subscribe to it. And a successful Instagram page, please like and follow it. Thank you.